Hello everyone, my name is Reggie. I am a therapist here in Florida, and I am coming at you again with another video in this series for the National Clinical Mental Health Counseling Exam Study Guide. This is the last video of the series for now, and this video is going to be all about the assessments, and I'm coming to you from the future. I have passed my exam. Woo! I passed my exam by 1 point. And truth be told, some of these very assessments are going to be on the exam. And so, I'm going to read a good 50 to 100 a type of assessments. And I know maybe a good five of them were on the exam for sure. And so when you think about these assessments, just think about the heavy hitters in terms of like anxiety, depression. When I say these symptoms, what should pop in your mind should be like the type of assessments that you should assess for. I don't assess for bipolar because that's more on the psychiatry side, but ADHD, so let's just get into this and we're going to go from there, right? This video might be a little on the lengthy side, but I have a spreadsheet that I'm going to be reading from, and I'm going to be reading the abbreviation of the assessment, the name of the assessment, the disorders that the assessment covers, the age groups that the assessments cover, and then the description of the assessment. Ready? You like it? Ready? Here we go. Thinking caps on. BDI, Beck's Depression Inventory. The symptoms it covers for the disorder of MDD, Major Depressive Disorder, ADHD, Attention Deficit Hyperactivity Disorder, Somatic Symptom Disorder, ages 13 through 80, assesses the severity of depression symptoms. WISC, Wechsler Intelligence Scale for Children, ADHD, ages 6 through 16, measures cognitive abilities across 5 domains: verbal comprehension, visual, spatial, fluid reasoning, working memory, and processing speed, using educational assessment and identifying learning disabilities. And let me make sure my screen covers everything. Give me one moment. Next one is SBIC, Stanford Binet Intelligence Scale. The disorder is ADHD, ages 2 through 85. Tests across different developmental stages, making it suitable for various settings, including schools and clinics. CRS, Connors Rating Scale, ADHD, ages 6 through 18, assesses adolescents for ADHD symptoms. VAS, Vanderbilt Assessment Scale, ADHD. I don't have ages or the description for that, unfortunately, so I'm going to move on and let you look at that up yourself. WRAT, Wide Range Achievement Test, ADHD, ages 5 through 94, assesses basic academic skills, including reading, spelling, and math, versatile for both children and adults. When I was growing up, there was an assessment for the 3 R's: reading, writing, and arithmetic. And it's just an achievement test. So it doesn't test for disabilities. It's just an achievement test. And so you want to know that when there's questions about a client who has disability issues, what assessment would you not assess for, And the other 3 options should be for disabilities. Whereas this one, the wide range achievement test, is just for achievement, literally, like how smart is your kid, versus, assessing for disability. So know that, okay? Moving on, ADES, Attention Deficit Evaluation Scale, assesses ADHD. There are actually 3 scales of this one. It's for children ages 3 through 7 and 8 through 12, adolescents 12 through 18, and adults 18 and above. The scales are designed to assess executive function impairments associated with ADHD. And you'll see a lot of these assessments when it has C at the end. It basically means that it's for a child, and you'll probably get an example of that coming soon. SDQ, Strengths and Difficulties Questionnaire, assesses ADHD, ages 2 through 18, ages 2 through 4, available for parents or nursery teachers. This version includes 22 items that are slightly adjusted to suit younger children. 4 through 17 for parents or teachers for children ages 4 through 17, which includes 25 items divided into 5 scales assessing emotional symptoms, conduct problems, hyperactivity and attention, peer relationship problems, and pro-social behavior. B, C, A, brief cognitive assessment. Assesses schizophrenia, ages 60 and up. 60 and up. Useful assessment for evaluating cognitive functioning in older adults who may be experiencing cognitive decline or impairment. MCCB, Matrix Consensus Cognitive Batter. Schizophrenia, ages 2 through 59. Identifies specific abnormalities related to the development of schizophrenia. Evaluates 7 key cognitive domains, including speed of processing, attention vigilance, working memory, verbal learning, visual learning, reasoning, and problem solving, and social cognition. ILSS, Independent Living Skills Survey, in the year 2000. If the assessment has a year with it, I will also say the year of the assessment as well. ILSS, Independent Living Skills Survey from the year 2000. Schizophrenia, ages 18 through 65, primarily designed for adults with psychiatric disorders, especially schizophrenia, schizoaffective disorder, and other serious mental illnesses. MASC, Maryland Assessment of Social Competence, from the year 1993. Assesses schizophrenia, ages 18 through 65. Performance-based measure designed to assess social skills and competence in people with serious mental illness, particularly schizophrenia. PANSS, Positive and Negative Syndrome Scale, from 1987. Assesses schizophrenia, 18 through 65. Most widely used clinical rating scales for assessing symptom severity in schizophrenia and related psychotic disorders. BPRS, Brief Psychiatric Rating Scale. Schizophrenia, 18 through 65, assesses psychiatric symptoms such as depression, anxiety, hallucinations, and unusual behavior. Originally developed for schizophrenia, but widely used for psychiatric conditions. BCATS, BCATS, Brief Cognitive Assessment Tool for schizophrenia. Assesses schizophrenia, 18 through 65. Short, practical tool to assess cognitive impairment in people with schizophrenia, designed as a faster alternative to Matrix Consensus Cognitive Batter, MCCB. HCL-32, Hypomanic Checklist, assesses bipolar 1 and 2, ages 18 through 65. Widely used self-report questionnaire for identifying hypomanic symptoms, especially in the context of bipolar disorder. MDQ. Oops, did I just skip one? I sure did. BSDS, Bipolar Spectrum Diagnostic Scale. Bipolar 1 and 2, 18 and up for bipolar 1, and less so for bipolar 2. Determines bipolar 2 and hypomanic episodes. MDQ, Mood Disorder Questionnaire, bipolar 1 and 2, 12 and up. Measures for a lifetime for mania and hypomania, not for monitoring, but evaluation. MSQ-46, Mood Swings Questionnaire Survey. Bipolar 1, 12 and up, screens for bipolar 2 disorder and depressed clients to distinguish bipolar 1 and bipolar 2. 13 questions and can be completed in about 5 minutes. CPSRS, Children's Psychiatric Symptom Rating Scale of the year 2007. Assesses DMDD, Disruptive Mood Dysregulation Disorder, ages 4 through 18. Widely used self-report questionnaire for identifying hypomanic symptoms, especially in the context of bipolar disorder in youth. Also evaluates behavioral and emotional symptoms such as aggression, anxiety, depression, inattention, and conduct problems. CGAS, Children's Global Assessment Scale, assesses DMDD, ages 4 through 16, designed to assess the overall psychological and social functioning of children and adolescents ages 4 through 16. HRSD or HAM-D, Hamilton Rating Scale for Depression. Assesses PDD, persistent depression disorder, and MDD, major depressive disorder. And I said in the previous video the difference between the two. Major depressive disorder, you're in bed, you can't do anything. Persistent depression disorder, you can work, you can earn a living, but you still have lingering sadness almost all day long, you know. You have moments of joy, but you kind of return to sadness, you know. 18 and up, clinician-administered tool designed to assess the severity of depression in adults ages 18 and older, not typically used for children or adolescents. MADRS, Montgomery-Asberg Depression Rating Scale, assesses PDD, 18 and up, measures the intensity of depressive symptoms, especially changes over time during treatment. Change that right now. CGIS, Clinical Global Impression Scale, PDD, any age, brief standardized assessment tool used by clinicians to evaluate a patient's overall functioning and response to treatment. HSCL-D, Hopkins Symptom Checklist Depression Scale. MDD, 12 and up, primarily for adults. HSCL-D is part of the HSCL-25, a self-report tool used to assess symptoms of depression and anxiety primarily in adults. ZSDS, Zung, self-rating depression scale. Zung, spelled Z-U-N-G. MDD, 18 and up, assesses the level of depression for patients diagnosed with depression disorder. WSQ, I guess it could be all depression then, or any depression, but it shows that, according to my research, it shows that it's specifically for MDD, but from what that description sounds like, it could be any level of depression. WSQ, Wakefield Self-Report Questionnaire, MDD, 18 and up, assesses symptoms commonly associated with depression. 12-item screening tool designed to assess symptoms of major depression in adults. It is not typically used for children or adolescents. For younger populations, consider tools like Mood and Feelings Questionnaire, MFQ. CQ, Coping Questionnaire, Parent and Child version of 2020. Separation anxiety, generalized anxiety disorder, social anxiety disorder, ages 7 through 17. Assesses perceived coping efficacy in anxiety-provoking situations. SASC, Separation Anxiety Scale for Children. Separation anxiety, 8 through 11, measures worry about separation, distress for separation, and calm at separation. SAAI-C, SAAI-P, Separation Anxiety Avoidance Inventory, and I'm sure you can assume what the C and P stand for. Separation anxiety, ages 8 through 17, assesses avoidance behaviors in children with separation anxiety disorder. The C is the child version, ages 8 through 17, and P is the parent version for parents of children ages 8 through 17. SAAS, Separation Anxiety Assessment Scale. Separation anxiety, ages 7 through 12, and ages 13 through 17. Assesses avoidance behavior in children with separation anxiety disorder. SAAS-child is ages 7 through 12. SAAS-adolescent is ages 13 through 17. SAAS-parent is for parents of children ages 7 through 17. PSWQ, Penn State Worry Questionnaire of the year 1990. Separation anxiety disorder, generalized anxiety disorder, 18 and up, designed to measure trait worry, especially in relation to GAD. PSWQ-C, GAD, generalized anxiety disorder. PSWQ-C, Penn State Worry Questionnaire, child of the year 2003, or the PSWQ-A, which is for adolescents. Social anxiety disorder, ages 7 through 17 and or 12 to 17. Adapted for children and adolescents, simplified language and developmentally appropriate items. Sometimes used as a bridge between child and adult versions depending on maturity and setting. BAI, here's one of the heavy hitters right here. I use this one frequently. BAI, Beck Anxiety Inventory of the year 1990, Anxiety 17 and up. Evaluates symptoms of anxiety, distinguishing them from depression. Most widely used tool for assessing clinical anxiety in adults and adolescents. SPAI, Social Phobia and Anxiety Inventory of the year 1989 and 1996. Social anxiety disorder, ages 14 and up, or 8 through 13. Short form version of the SPAI, developed to provide a quick and reliable assessment of social anxiety disorder. Adapted for younger children with simplified language and age-appropriate scenarios. I totally just jumped to the next one while reading that, but SPAI is for 14 and up. SPAI 18 or SPAIC. Social Phobia and Anxiety Inventory 18. Social Phobia and Anxiety Inventory for children. Social anxiety disorder, ages 14 and up, or 8 through 13. Short form version of the SPAI, developed to provide a quick and reliable assessment of social anxiety disorder. Adapted for younger children with simplified language and age-appropriate scenarios. The SPAI is the Social Phobia and Anxiety Inventory of 1989-1996, designed to measure the severity and specific features of social anxiety disorder, aka social phobia. I don't recall seeing that on exam, but you kind of can put them together what they mean in the context of the question, though, you know. But some of them you just literally just have to know, and that's why I'm giving you this entire lovely list of assessments. DISC, Diagnostic Interview Schedule for Children, year 1984. Social anxiety disorder, doesn't give an age, and the description gives an age. DISC-Y, Youth Version, ages 9 through 17. DISC-P, Parent Version, for parents of children ages 6 through 17. Highly structured, computerized interview designed to assess mental disorders in children and adolescents based on DSM criteria. Covers over 30 diagnoses, including anxiety disorder, mood disorders, and disruptive disorders. K-SADS, Schedule for Affective Disorders and Schizophrenia for Children, from the year 1978. Social anxiety disorder, there's a lot of social anxiety disorder assessments apparently. 6 through 18, semi-structured diagnostic interview used to assess current and past episodes of psychopathology in children and adolescents. Modules for mood disorders, anxiety disorders, psychotic disorders, behavioral disorders, eating disorders, and substance use disorders. ADIS-C, Anxiety Disorders Interview Schedule for Children, year 1996. Social anxiety disorder, ages 7 through 17. ADIS-C, Child Version, Self-Report. ADIS-P, Parent Version, Caregiver Report. Diagnosis, anxiety disorders and comorbid conditions such as separation anxiety disorder, generalized anxiety disorder, social phobia, panic disorder, specific phobias, obsessive compulsive disorders, PTSD, depression, and ADHD. That's a heavy hitter right there. SASC-R, Social Anxiety Scale for Children, Revised, 2010. Let me put my glasses back on. Social anxiety disorder, ages 8 through 15. Widely used self-report instrument designed to assess social anxiety symptoms in children and early adolescents. SIAS, Social Phobic Scale and Social Interaction. Social anxiety disorder, 16 and up. Assess different dimensions of social anxiety in adults and older adolescents. IAS, Interaction Anxiousness Scale, 1983. Social Anxiety Disorder, 16 and up. Assess dispositional social anxiety, particularly anxiety experienced during interpersonal interactions. BS-PS, Brief Social Phobia Scale of 1991. Social Anxiety, 18 and up. Clinician-rated instrument designed to assess the severity of social phobia symptoms, particularly in adults diagnosed with social anxiety disorder, SAD. LSAS, Leibowitz Social Anxiety Scale, 1987. Social anxiety disorder, 16 and up. This is the last social anxiety disorder, so we're moving on after that. 16 and up, a widely used tool for assessing social anxiety disorder in adults and older adolescents. PDSS, Panic Disorder Severity Scale of 2001. Panic disorder, 18 and up, widely used clinical tool designed to assess the severity of panic disorder symptoms and monitor treatment progress. PDSS-C, ages 11 through 17, adapted from the adult version to be developmentally appropriate, assesses panic disorder and agoraphobia symptoms in youth. FQ, Fear Questionnaire of 1979. You have to think if 1979 is like with the times, you know? And so with these assessments, you definitely want to see if they're just if they've like stood the test of time, you know what I mean, in terms of questions. I'll just leave it at that. Fear Questionnaire, 1979, Panic Disorder, 16 and up, assesses avoidance and distress related to common phobic situations. Fear Survey Schedule for Children, revised, FSSC-R, ages 7 through 16. HAM-A, Hamilton Anxiety Inventory. Generalized Anxiety Disorder, 18 and up, used in adult populations for assessing generalized anxiety disorder and treatment responses. When not originally designed for younger populations, some clinicians have adapted the HAM-A for use with adolescents aged 12 to 17 and even children under the age of 12. MASQ, Mood and Anxiety Symptom Questionnaire of 1991. Generalized Anxiety Disorder, 18 and up, primarily designed for adolescents ages 16 and up and adults ages 18 and up, assessing mood and anxiety symptoms. GAD-4, GAD-4, Generalized Anxiety Disorder Scale 4 of the year 2014. Generalized Anxiety Disorder 11 through 17. Tracks symptoms, oh my god, sorry, I'm like stuttering all of a sudden. Tracks symptom severity in children and adolescents. GAD-7, Generalized Anxiety Disorder Scale of the year 2006. Generalized Anxiety Disorder, ages 13 and up, designed to screen for and measure the severity of generalized anxiety disorder. PANAS, Positive and Negative Affect Schedule, 1988. This one has a long explanation, and I'll try to break that down as well. Generalized Anxiety Disorder, ages 18 and up. Watson and Clark of the year 1991 defined the PANAS as the most widely used measure of affect. It assesses two dimensions of mood. Positive affect measures enthusiasm, alertness, and active engagement. And negative affect measures the distress, fear, and nervousness. There are modified versions of the PANAS for younger age groups. The PANAS-C, which is the child version, suitable for ages 8 through 11, and the PANAS-X, the extended version, used in broader research contexts, sometimes adapted for adolescents. And I feel like that explained everything, so I'm not going to expound. BAI-Y, Beck Anxiety Inventory for Youth. I use the BAI for adults. Generalized Anxiety Disorder, ages 7 through 18, assesses for anxious symptoms. RCMAS-2, Revised Children's Manifest Anxiety Scale, 2nd edition, year 2008. I have never heard of this. And this is my own screen. This is my own spreadsheet. I'm like, I have never heard of this. Generalized Anxiety Disorder, ages 6 through 19. The RCMAS contains a 49 item and age appropriate for ages 6 through 19. 49 items inappropriate for ages 6 through 19. Scales include physiological anxiety, worry, social anxiety, and defensiveness. CBL, Childhood Behavior Checklist of 2001, Generalized Anxiety Disorder, ages 4 through 18. Parent form, the CBCL, Youth Self-Report, the YSR, and the Teacher Report form, TRF. The CBCL scales include internalizing and externalizing and 8 subscales. Internalizing subscales: withdrawn, somatic, complains, anxious / depressed. Interesting. Static, C. State, trait, anxiety inventory for children, the year 1973. Generalized anxiety disorder, ages 9 through 12, has 20 items per scale. FSSC-2, Fear Survey Schedule for Children, 2nd edition. Generalized anxiety disorder, 7 through 18, contains 75 items. Scales included are total fear and 5 subscales: fear of the unknown, fear of failure / criticism, animal fears, fear of death and danger, and school medical fears. ADIS-C. I feel like I've done this one already, but this might be a different version. Anxiety disorders interview schedule for DSM-4 child version of 1996. So apparently this one's slightly outdated. I could have skipped over this, but why not? Let's just keep going. Generalized anxiety disorder, ages 6 through 16. Interview is to assess anxiety, mood, and externalizing symptoms. This one I don't have the abbreviation because it's not the same BAI. Burns Anxiety Inventory. Generalized anxiety disorder, 18 through 80, helps evaluate anxiety symptoms and is particularly useful for those with communication or cognitive deficits resulting from neurological injuries. That's Burns, BURNS. This next one was on my exam. Y-Box. Y, the letter Y, dash BOCS. This one was in the exam, and I was like, oh, I know this one. You know, Yale Brown Obsessive Compulsive Scale of the year 2015. Assesses obsessive compulsive and related disorders, ages 18 through 85. Most frequently applied tests in clinical settings for OCD. The scale assesses for the presence and severity of obsessions and compulsions in the past week. The Y-Box is composed of 10 items. 5 measure the severity of obsessions, and 5 measure the severity of compulsions. The CY-Box is the Children's Yale Brown Obsessive Compulsive Scale for ages 6 through 17. Moving on. TFI, Thought Fusion Instrument, year 2011. Obsessive compulsive and related disorders, 18 and up. Psychological assessment tool designed to measure metacognitive beliefs related to intrusive thoughts. Metacognitive, the thoughts of your thoughts. Thinking about your thoughts, how you think about your thoughts. Designed to measure metacognitive beliefs related to intrusive thoughts, especially those common in obsessive compulsive disorder. TAIFIC, which is a part of this. I'm not moving on to another one. This is just part of the description. Thought Action Fusion Inventory for Children. Got it. OCI-R, Obsessive Compulsive Inventory Revised of the year 2002. OCD and related disorders, 16 and up. Assesses OCD symptoms across 6 domains: washing, checking, ordering, hoarding, obsessing, and neutralizing. The format is an 18-item self-report questionnaire. OCI-CV-R, the child version, ages 7 through 17, measures OCD symptoms in youth, excluding hoarding, which is now considered a separate condition. Domains assessed are doubting, checking, obsessing, washing, ordering, and neutralizing. The format is 18 items rated on a 3-point scale from never to always. FAS, Family Accommodation Scale 2016, Obsessive Compulsive and Related Disorders, 18 and up. Measures the most frequently occurring phenomenon that is linked to treatment response, increased OCD symptom severity, and lower levels of functioning. Versions FAS-PV, patient version, FAS-SR, self-rated, FAS-IR, interviewer rated. TOVA, test of variables of attention. ADHD. This one, I feel like it was on the exam. I just can't remember at this very moment, but it sounded like super familiar. TOVA, T-O-V-A, ADHD, measures, oh my god, let me put my glasses back on, sorry. Measures sustained attention, response time, impulsivity, and inattention. Ages ranged by format. The visual TOVA, normed for ages 4 through 80 plus. Sounds like just any above the age of 4. Auditory TOVA, for ages 6 through 19, designed to assess attention using auditory stimuli used for individuals with visual impairments or specific auditory processing concerns. BASC, Behavioral Assessment Scale for Children. This one doesn't have a disorder in my notes that it assesses for, or nor an age group, but the description kind of breaks that down. Designed to assess the behavior of emotions of children and young adults across a wide developmental span. Age ranges by form. There's preschool form, ages 2 through 5, child form, ages 6 through 11, adolescent form, ages 12 to 21, and a college form, ages 18 through 25. Behavioral Assessment Scale for Children, BASC. So I guess 18 through 25 are still considered children. DES-2, Dissociative Experiences Scale-2, Dissociative Disorders, 18 and up. The Dissociative Experiences Scale-2 is a 28-item self-report instrument designed to screen for dissociative symptoms in adults. It's widely used in both clinical and research settings to identify individuals who may benefit from further assessment for dissociative disorders. The DES-2 assesses the frequency of dissociative experiences across 3 domains: amnesia, gaps in memory or awareness, for example, not remembering how you got somewhere; depersonalization, derealization, feelings of detachment from self or surroundings; absorption, imagination, involvement. Oops, that's the next one, sorry. Absorption, imaginative involvement, intense focus or immersion that reduces awareness of the external world. MID, Multidimensional Inventory of Dissociation, Dissociative Identity Disorder and Other Specified Dissociative Disorder, 18 and up. The Multidimensional Inventory of Dissociation, or the MID, is a comprehensive clinician-administered self-report tool designed to assess dissociative symptoms across a wide spectrum of experiences. It is particularly useful for identifying features of complex dissociative disorders, such as dissociative identity disorder, DID, and other specified dissociative disorders, OSDD. CAPS-5, Clinician-Administered PTSD Scale, 1990. Assesses PTSD, ages 18 and up. It's the gold standard PTSD assessment, so I feel that's noteworthy. Lengthy in questions, takes approximately 50 through 60 minutes to administer. The child-adolescent versions, the CAPS-CA and the CAPS-CA-5, is for ages are for ages 7 through 17. PCL-5, Post-Traumatic Checklist, Post-Traumatic Stress Disorder, 18 and up, most widely used self-report measure for PTSD. A lot of these assessments had that same description, most widely used tool for. I'm like, okay, all of them can't be the most widely used tool, you know what I mean? For that specific disorder, multiple in the same disorder, like most widely used tool. I'm like, all right, can't be for everything, can it? All right, PCL-5, Post-Traumatic Checklist, PTSD, 18 and up, most widely used self-report measure for PTSD. The PCL-5 has 20 items and is aligned with the DSM-5 criteria. Child and adolescent versions equals the Child PTSD Symptom Scale, the CPSS, ages 8 through 18 in the UCLS PTSD Reaction Index, for ages 6 through 18. IES-R, and I feel like this one's pretty important because I remember seeing this a lot just in my studies. And yeah, Impact of Event Scale-Revised 1997, PTSD 18 and up. Self-report measure designed to assess distress caused by traumatic events. IES-R measures symptoms of PTSD, such as intrusive thoughts and nightmares, avoidance, emotional numbing and avoiding reminders, and hyperarousal, irritability, difficulty concentrating. PDS, Post-Traumatic Stress Diagnostic Scale, 1995. Post-traumatic stress disorder, 18 and up, screens for PTSD, assesses symptom severity, and supports diagnosis. The structure has a trauma exposure checklist, symptom severity items, and functional impairment questions. M-PTSD, Mississippi Scale for combat-related PTSD, 1988. Sorry, my eyes are dry. PTSD, 18 and up, designed for use with adult military veterans 18 and up, validated mostly with Vietnam-era veterans, but also used with but also used with veterans from other service era, for example, the Gulf War, Desert Storm, post 9/11, etc. Assesses PTSD symptoms and related features such as depression, suicidality, and substance abuse. SI-PTSD, Structured Interview for PTSD, 1991. PTSD, 18 and up, assesses the 17 DSM-4 PTSD symptoms, including survival and behavioral guilt. Clinician-administered structured interview. Administration time is approximately 20 to 30 minutes. SCID-R, Structured Clinical Interview for DSM Disorders Revised. Acute Stress Disorder, 18 and up, designed for use with individuals 18 and up. It is a semi-structured diagnostic interview used by trained clinicians to assess major DSM-5, or DSM, doesn't say which DSM version, DSM psychiatric disorders. IESR, and I feel like that's very similar to the one I just said earlier. Well, the one I said earlier was for PTSD, and this one also is for acute stress disorder. Well, let me see if the descriptions are different. Yep, this one is different, so I'm just going to read that now. IESR, Impact of Event Scale Revised. Acute stress disorder, 18 and up, measures subjective distress caused by traumatic events, primarily for use with adults 18 and up, but it has also been used with adolescents 12 and up. 22-item self-report scale assessing intrusion, avoidance, and hyperarousal. All right. ADNM-8. Adjustment Disorder New Model. Adjustment Disorder 18 and up. Evaluates responses to acute and chronic stressors over the past 2 years, assessing symptoms of adjustment disorder based on the ICD-11 criteria for individuals 18 and up. PDI, Peri-Traumatic Distress Inventory. Adjustment Disorder 18 and up. Identify individuals at risk of developing PTSD by measuring distress at the time of trauma. PDI is a self-report tool designed to assess emotional, physiological distress experienced during or immediately after a traumatic event. Standard PDI is 18 and up. The child version is the PDI-C for ages 8 to 15, often administered to youth shortly after trauma exposure to assess the risk of PTSD. SCL-90R, Somatic Subscale of Symptom Checklist -90. Somatic Symptom Disorder 13 and up measures the stress related to physical symptoms that may not have a clear medical cause, for example, headaches, dizziness, or gastrointestinal issues. PHQ-15. I use the PHQ-9 a lot. I feel like that's the most common assessment that I use, apart from like the biopsychosocial when I first meet a client or whatnot. But I do the PHQ-9 like at least once a month with a client if I see them like weekly, just to get taps on where they're at. You know, if if they're in the struggle mode, if they're just in maintenance and just come in and just chat, I suppose I don't use the PHQ-9. But if they're kind of going through it and it's been like a month or 2 months or 3 months, and they're still in the thick of whatever they're going through, I'll use the PHQ-9 from time to time just to see there's the severity of their level of depression or whatnot. PHQ-15, Patient Health Questionnaire-15, which is apparently a little bit more in depth than the PHQ-9. Somatic symptom disorder screens for somatization and helps identify patients who may benefit from further evaluation for somatic symptom disorders. The PHQ-9 is specifically depression, and so this one's totally different from the PHQ-9. Oops. Yeah. Okay, I did read that right. Okay, great. I was like, did I read this right? SF-36, Short Form Health Survey, Somatic Symptom Disorder, 14 and up. Assesses 8 domains of health-related quality of life, including physical functioning, pain, vitality, and mental health. Shorter version is the SF-12. We're getting some eating disorders. I guess we're more than halfway through. All right. We're getting into some eating disorders. EDE, Eating Disorder Examination. Cut and dry, right? It is for anorexia nervosa disorder, bulimia disorder, and binge eating disorder. 16 and up. Gold standard. 22 items, measures core areas of behavioral and attitudinal features of eating disorders. 4 subscales measure dietary restraint, shape concern, weight concern, and eating concern. The child version is the EDE-C for ages 8 through 14. EDI-3, Eating Disorder Inventory. Anorexia, bulimia, binge eating. Ages 13 to 53. Provides a standardized clinical evaluation of symptomology associated with eating disorders. EAT-26, or the Eating Attitudes Test. I think that was a little pointed by the way that they made this the acronym. EAT-26, Eating Attitudes Test. Anorexia, bulimia, binge eating. Ages 12 through 30 or 18 and up. Primarily designed for use with individuals in the age range of 12 through 30, particularly adolescents and young adults who may be at risk for developing eating disorders such as anorexia nervosa and bulimia nervosa. BITE, Bulimic Investigatory Test of Edinburgh. Bulimia, binge eating, ages 12 through 18. The BITE identifies symptoms of binge eating or bulimia, and has been validated for use primarily with adolescents and adults. While the BITE can be used with adults as well, its application in younger children is less common and may require additional clinical judgment and adaptation. The BSQ, Body Shape Questionnaire, Bulimia, Binge Eating, 13 and up. The BSQ measures concerns about body shape perceptions. For those with eating issues, the BSQ is a widely used self-report tool designed to assess body image concerns, particularly the cognitive and emotional aspects of body dissatisfaction. CBCL, Child Behavioral Checklist, Oppositional Defiant Disorder, one of my favorites. I say sarcastically. CBCL, Child Behavior Checklist, OCD, 18 months through 5 or 6 through 18. The CBCL is a widely used standardized assessment tool developed by Thomas Achenbach to evaluate behavior and emotional problems in children and adolescents. Versions CBCL-1.5 through 5, 18 months through 5 years, completed by parents to assess preschool age children. CBCL/6- through 18. Completed by parents for school-aged children and teens. The TRF, the Teacher Report Form, is for 6 to 18, ages 6 through 18, completed by teachers to provide school-based observations. The YSR, the Youth Self-Report, ages 11 through 18, completed by the child or the adolescent themselves. Moving on. ASEBA, Achenbach System of Empirically Based Assessment. ODD, The Achenbach System of Empirically Based Assessment, ASEBA, is a comprehensive suite of tools developed by Thomas Achenbach to evaluate behavioral, emotional, and social functioning across the lifespan. It's one of the most widely used systems in clinical psychology, education, and research. The versions, all the previous in the child behavior checklist and ASR, adult self-reporting, is ages 8 through 59, completed by adults, measures adult psychological functioning. The ABCL, adult behavior checklist, at ages 18 through 59, completed by someone who knows the adult well. Observer-rated versions of the ASR, older adult forms, ages 60 and up, completed by self and an informant, tailored for older adults' behavioral and emotional health. Moving on. ECBI, IBERG, spelled EYBERG, IBERG Child Behavior Inventory. ODD, ages 2 through 16. The ECBI is a parent report questionnaire designed to assess disruptive behaviors in children and adolescents. It's widely used in clinical and research settings to identify conduct-related issues and monitor treatment progress, completed by parents or primary caregivers. The IED-SQ, Intermittent Explosive Disorder Screening Questionnaire of 2016. Intermittent explosive disorder, ages 6 and up. The IED-SQ is a self-assessment tool designed to help individuals identify symptoms consistent with intermittent explosive disorder, a condition marked by sudden, intense outbursts of anger or aggression that are disproportionate to the situation. Adult version is the IED is more prevalent in individuals under age 40. BIS-11, Barrett Impulsivity Scale of 1995, Barrett spelled BARRATT. Intermittent explosive disorder, ages 12 and up. The BIS is one of the most widely used psychological tools for measuring impulsivity as a personality trait. The BIS-11 is the most commonly used version, consisting of 30 items rated on a 4-point Likert scale. The BIS-15 and the BIS Brief are shortened versions for quicker screening with 15 and 8 items respectively, primarily validated for adults and adolescents, used in populations ranging from teenagers to older adults, not typically used with children under the ages of 12. BPAQ, Buss-Perry Aggression Questionnaire. Buss spelled BUSS-Perry Aggression Questionnaire of 1992. Intermittent explosive disorder, 18 and up. The BPAQ is a widely used self-report tool designed to measure different dimensions of aggression in individuals, primarily validated for adults age 18 and older. Research shows higher aggression scores among younger adults ages 18 through 35 compared to middle-aged and older adults. A revised version, the Buss-Warren AQ of the year 2000, expanded the age range to include individuals from 9 through 88, adding a fifth factor, indirect aggression. I wonder if that's like passive aggressiveness or something. CDI, Children's Depression Inventory. Let me see how. I guess we're kind of winding down here. Children's Depression Inventory. Conduct disorder and depression is what it assesses for, ages 7 through 17. The CDI is a widely used self-report questionnaire designed to assess depressive symptoms in children and adolescents. CDI evaluates negative mood, interpersonal difficulties, negative self-esteem, ineffectiveness, and anhedonia. CDI-2 expanded to include ages 8 through 21, making it suitable for older adolescents and young adults. BDI-2, I use this one commonly, BDI-2, Beck's Depression Inventory -2. For a while I was using just the BDI, but there's a second version, which is this one. It assesses depression and conduct disorder for ages 13 through 80, so basically teenagers and up. Beck's Depression Disorder 2 is one of the most widely used self-report tools for assessing the severity of depressive symptoms in adolescents and adults. HAM-D, HDRS, I feel like I did this one already. Hamilton Rating Scale for Children in 1960. Conduct Disorder, 18 and up. The Hamilton Rating Scale for Depression, HAM-D, also known as the Hamilton Depression Rating Scale, HDRS, was originally developed for adults and is one of the most widely used clinician-administered tools to assess the severity of depression symptoms. CES-D, Center for Epidemiologic Studies Depression Scale. Conduct Disorder, Depressive Symptoms. The Center for Epidemiologic Studies Depression Scale, CES-D, is a widely used self-report questionnaire designed to measure depressive symptoms in the general population. Measure sadness and depressed mood, anhedonia, appetite and sleep disturbances, feelings of guilt or worthlessness, difficulty concentrating, fatigue, and suicidal ideation. Originally developed for adults, but has been successfully used across a wide age ranges. Validated for use with adolescents, young adults, and older adults. The SASSI, SASSI, Substance Abuse Subtle Screening Inventory. Substance use disorder. The SASSI, SASSI, is a widely used psychological tool designed to identify individuals who may have a substance use disorder, including alcohol-related issues. It's known for its ability to detect substance abuse, even when individuals are unwilling or unable to acknowledge their problems directly. The SASSI-A3 is for ages 13 through 18. The SASSI-4 is for ages 18 and up. The Spanish SASSI is for ages 18 and up for Spanish-speaking adults. The MAST, Michigan Alcohol Screening Test. This one's a pretty common one that you'll see on tests, I find. Alcohol use disorder, 18 and up. The Michigan Alcohol Screening Test, or the MAST, is one of the most oldest and widely used tools for identifying alcohol dependence. Developed by Dr. Melvin L. Selzer, Selzer, in 1971, it remains a trusted instrument in clinical research and rehabilitation settings. This one doesn't have initials because of I just now caught why. The Alcohol Severity Scale, because that would just be the ASS. I guess there's no abbreviation for that for some odd reason. The Alcohol Severity Scale assesses alcohol use disorder 18 and up. The Alcohol Severity Scale typically refers to tools used to assess the severity of alcohol use disorder. Two prominent instruments in this category are Addiction Severity Index, ASI, evaluates the severity of substance use across multiple life domains. Brief Alcohol Use Disorder Severity Scale, or the BAUDSS, a newer validated tool for measuring AUD severity in clinical settings. All right. This is the last alcohol use disorder. Moving on. CAGE, cut, agitation, guilt, I. Alcohol use disorder, 18 and up. The CAGE questionnaire is a brief and widely used screening tool for identifying potential alcohol use disorders. Each letter corresponds to a key question. C. Have you ever felt you should cut down on your drinking? A. Have people annoyed you by criticizing your drinking? Agitation, annoyed. G. Have you ever felt guilty about your drinking? E. Have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover? An eye opener. There we go. Moving on. GAPD, General Assessment of Personality Disorder. Assesses borderline personality disorder, 18 and up. The General Assessment of Personality Disorder, the GAPD, is a psychometric tool designed to evaluate core features of personality pathology across the diagnostic categories. Unlike instruments that focus on specific personality disorders, for example, borderline or antisocial, the GAPD aims to assess general impairments in personality functioning. PID-5, Personality Inventory for the DSM-5, assesses borderline personality disorder, 18 and up. The PID-5 is a self-report questionnaire developed to assess maladaptive personality traits based on the alternative model for personality disorders, AMPD, in Section 3 of the DSM-5. It supports a dimensional approach to personality pathology, moving beyond categorical diagnoses, scales of factors, emotional lability, anxiousness, separations, insecurity, hostility, depressivity, impulsivity, risk-taking, and negative affectivity. PAI, Personality Assessment Inventory - borderline personality subscale. Assesses borderline personality disorder. There is no age group, and I will explain why. The Personality Assessment Inventory, the PAI, includes a dedicated borderline features BOR subscale, which is designed to assess core characteristics of borderline personality disorder. This subscale is part of the broader clinical scales within the PAI and provides a dimensional measure of borderline traits. The BOR scale captures the 4 key components of borderline pathology. BOR-A, affective instability, rapid mood shifts, emotional lability. BOR-I, identity problems, unstable self-image, chronic emptiness. BOR-N, negative relationships, intense, unstable, and conflictual interpersonal relationships. BOR-S, self-harm, impulsivity, suicidal ideation, and self-injurious behaviors. This one, you should know. The next one, all therapists should know. This next one, for real. Or CSSRA, Columbia Suicide Severity Rating Scale. If you're a therapist, you need to know this one, because if a client has a hint of suicidal ideation, like, you need to use this one, or assess a client's severity of SI. And so I'll do the PHQ-9, or the cross-cutting, the one that's in the DSM-5. And they both ask questions like, do you have, in the last 2 weeks, have you had thoughts of harming yourself or harming yourself? And if they say yes, always ask them, do you have a plan? The CSSRS is like a flow chart kind of thing. If they say yes, it kind of goes into more depths of that. But I will explain that right now. Ages 12 and up. The CSSRS is a widely used evidence-based tool designed to assess suicidal ideation and behavior. It helps clinicians, researchers, and other professionals identify individuals at risk. If they have SI, your job as a therapist is to eliminate the SI, to eliminate, you can't be with them 24/7, but under your care, you need to make sure that they do not have SI anymore, because that's a big deal. Big thing to deal with, and you want to make sure that they're not going to harm themselves or others under your care. All right, winding down, almost done. HTP, House Tree Person, ages 3 and up. HTP, House Tree Person, is a classic projective drawing test used in psychological assessments to explore personality, emotional functioning, and interpersonal dynamics, developed by John M. Buck in 1948. It remains popular in clinical, educational, and forensic settings. Participants are asked to draw a house, which reflects the perceptions of home life, safety, and family relationships, a tree, which symbolizes self-image, strength, and personal growth, and a person, which reveals self-concept, social relationships, and identity. So if a boy is drawing a little girl, or a girl is drawing a little boy, or whatever the case may be, it kind of is very telling, right? Typically, children do this. We had to do this in grad school, right? We all drew it, and our professor kind of broke ours down. I'm not even going to tell you how I drew mine. I drew like a mansion in 3D with a courtyard in the middle of the house. It was pretty dynamic. Anyways, I guess you can analyze that for those who are trained out there. And a person, which reveals self-concept, social relationships, and identity. These drawings are followed by structured interview questions to probe the meaning behind each element. TAT, Thematic Apperception Test, ages 13 and up. The TAT is a classic projective psychological assessment designed to uncover a person's underlying thoughts, emotions, and interpersonal dynamics through storytelling. Participants are shown ambiguous black and white images depicting people in various situations. They are asked to create a story for each image, addressing what led up to the scene, what is happening now, and what the characters are thinking and feeling, how the story ends. The idea is that the individuals will project their own internal world into the ambiguous stimuli, revealing psychological features or psychological themes. Draw a family picture test. This is for children. You know, when you see somebody's refrigerator and it has the family, you know, draw a family. You think kids do that in school, you know, just for funsies, but it's really like kind of seeing what home life is like, you know. If it's just like a boy and his mom, it's like, okay, where's dad? Do you have any siblings? Like, you know, what's going on? And draw a family picture test, also known as the family drawing test, is a projective technique used primarily with children to explore their perceptions of family relationships, emotional dynamics, and self-concept within the family system. The child is asked to draw a picture of the family, often with a minimal instruction. For example, draw a family doing something. The family is followed by clinical interview questions to explore the child's narrative and emotional associations with the figures. SCT, Sentence Completion Test, 13 and up. The SCT is a semi-structured projective technique used in psychological assessment to explore personality traits, emotional functioning, and underlying attitudes. It's widely used in clinical, educational, and organizational settings. SCTs assess self-concept and identity, family and interpersonal relationships, motivations, fears, and conflicts. Emotional adjustment and coping styles. Respondents are given sentence stems. For example, I feel angry when, and asked to complete them freely. Their responses are believed to reflect conscious and unconscious thoughts, attitudes, and beliefs. SCTs explore needs, inner conflicts, fantasies, attitudes, aspirations, adjustment difficulties, and sexual abuse in children and adolescents. Story STEM assessment profile is for ages 4 through 11. It's semi-projective, narrative-based measure. Last couple ones. SSAP, Story STEM assessment profile, ages 4 through 11, is what I just read in the last part of that. The SSAP is a play-based narrative assessment tool designed to explore young children's internal representations of attachment, family relationships, and emotional functioning. It's especially useful for clinical and maltreated populations. SDQ, Strengths and Difficulties Questionnaire, ages 2 through 17. The Strengths and Difficulties Questionnaire is a brief behavioral screening tool designed to assess emotional and behavioral problems in children and adolescents ages 2 through 17. The SDQ consists of 25 items divided into 5 subscales: emotional symptoms, conduct problems, hyperactivity/inattention, peer relationship problems, pro-social behavior. These can be combined in a total difficulty score based on the first 4 subscales, or grouped into internalizing and externalizing domains for broader analysis. I feel like this was on the exam, and I can't remember, but I was like, this seems super familiar. And lastly, the Stanford-Binet, Binet spelled Binet, intelligence scales for ages 2 through 85. These Stanford-Binet intelligence scales are one of the most enduring and widely used tools for assessing intelligence and cognitive abilities across the lifespan. Originally developed for the Binet-Simon scale in the early 20th century, the test has undergone multiple revisions, with the current version being the Stanford-Binet 5th edition, SB5. Offers adaptive testing, and meaning items adjust based on the examinee's performance. Especially useful for identifying intellectual giftedness, diagnosing intellectual disability, educational planning, and neuropsychological evaluation. So this is what I mean when I was telling you about examinations that are for like disability and so intellectual achievement is different from achievement, and so the question or the exam is very it's like wordy, like it's semantics. It's like semantics. So, again, intellectual achievement is different from achievement. I don't want to confuse you there, but so a test that is assessing disabilities is different from a test that's assessing achievement. So just something to remember: if I can pass the exam, anybody can pass the exam with enough studying, hard work. I got off social media. I was not I was in the zone. I didn't go out. I didn't do anything. I was just work out, study, work out, study. That was my life for a good 6 months. No, I got off of social media in July, August, September, October. So for 4 months, I was just work out, study, work out, study. And I passed the exam by 1 point. Just to give my own little experience of the exam in this last couple minutes of this video, I went into the examination room. It was a proctored exam at Pearson, and the exam type of my exam was at the top of the screen. You could see that I was taking the National Clinical Mental Health Counseling exam. In the middle of the exam offers you a break. Do you want to take a break? And of course I said yes, because I had been sitting there for hours and just I was just in a tunnel, and I needed to get up. I needed to stretch and walk around, use the bathroom, walked up and down the hallways just to move my body, right? Because I'd just been sitting there for hours. And you can see the clock. You can see the time clock going down of how much time you have allotted. I think it was 3.5 hours, 4. Either way, at the midway point, the exam will tell you to take a break, or you have the option to take a break. I chose it, of course. And on the way back, I noticed that different people were taking different exams. You see x-ray questions. There's a lot of people in there for nursing and doctors and XYZ. But I noticed the girl sitting next to me was taking the exact same exam, because I could see it at the top of her screen. And at my halfway point, I was on question 50, 55 out of 145. Well, at her halfway point, she was on question 100. So I was like, oh my God, I have to speed up. I was so caught up with the vignettes. The vignettes are very long on the exam, When my practice exams, the vignettes were maybe a paragraph at 2, 3 at the most. On the exam, they just seemed to be so long. They were really, really so long. And I spent so much time focusing on the vignettes that I was just I wasn't really pacing myself well. I was just reading rather slow, apparently. And I was like, oh my God, I have to speed up. So I see the clock dwindling, and it got to the point where I wasn't even reading the vignettes anymore. I just went straight to the question, whatever the first thing that came to my mind, I just answered. And I was getting discouraged because of that, because I was speeding up. I was going fast, and I was like, oh man, I'm not going to make it. Oh man. I was really doubting myself while taking the exam. And so I said to myself, if I finish all the questions, I at least have a better chance of passing than I would if I just left some questions on the table, And so I was just lightning round. Read the question, first answer. Read the question, first answer. And if it was so oblivious, I had to then go to the vignette and try to skim really quickly and try to get a sense of what I'm reading or what the questions are about, or who the client of the questions. But Y-Box was on there, the Yale Brown obsessive compulsive scale. And so just think about the heavy hitters: anxiety, depression, OCD, ADHD. Again, maybe not so much for bipolar, because that's more in the psychiatrist realm, but you still need to know it for the exam. And so think about the heavy hitters. I had a lot of kid questions, which is crazy because I primarily work with adults. So I was like, oh my God, I was really blindsided by that, because I work with adults. So I don't have a lot of kids, and I was really, really, really blindsided by that. And so I was really carefully reading the vignettes and all this and all that. And I just recall, whatever your office demographic is in terms of the clients that you work for, just throw that out of the window. Throw that out of the window. While you're studying, you need to know everything, And then when you get back to your practices, you can focus on the demographics that you work with. But again, for this exam, you got to know everything. And so for the assessments, I would just recommend that you just study the heavy hitters, anxiety, depression, and whatever I emphasized during the video. I was just jumping for joy afterwards. I was crying. I was beside myself. I was shook because I totally thought I failed. And I passed by a point, and I was beside myself. That was one of the greatest days of my life. And so I wish that upon you as well, and you can do it. Again, if I can do it, you can do it. Get off social media, don't hang out with friends, just really put yourself in the tunnel of studying, and you can pass too. So I wish you well. Good luck.